Alrighty, folks, welcome to another edition of the Healthy Way right here in Love 101 FM, the family station. It's a Tuesday, where we head on a Tuesday, right? To the dentist, yeah? Now, today we're talking about everything you need to know about oral cancer. Now, the incidence of oral cancer is closely tied to excessive alcohol and tobacco use. About 80% of people with oral cancer use tobacco, and about 70% are heavy drinkers. For people who both smoke and drink heavily, the risk of oral cancer may be twice as high as the risk for those who do not smoke or drink. April is Oral Cancer Awareness Month, so today we will be discussing all you need to know about oral cancer. And with us this morning is Chantal Richards, dental hygienist at Pure Smiles. Hey Chantal, how are you?
Hi, Savani. Good morning. How are you doing?
Very well, thanks. Good to have you as always.
Yes.
Talk to us, Chantal. What is oral cancer?
Okay, so oral cancer is a type of cancer that occurs when cancer cells begin growing out of control in the mouth. And when I say the mouth, that includes the actual lip. It includes the lining of the lip, the cheek. Your teeth are included in that. Your gums are included in that. Most of the tongue, and also the bottom of your mouth, which is what you can feel under your tongue,
Right.
and the hard part of your mouth, which is at the top, that you can feel, and you feel like some ridges and stuff are up there.
Okay.
So it can occur basically anywhere within the mouth.
And let's talk a little about some symptoms. What are the symptoms of oral cancer?
Well, usually oral cancer symptoms, they can be mistaken for just about anything. It can be mistaken for a regular toothache. It can be mistaken for a regular mouth ulcer or pain in your mouth. But there are some significant symptoms that you can look out for, and this includes a sore in your mouth that does not heal. And when I say it does not heal, I'm talking about 3 going on 4 weeks. You notice that this sore is there,
Right.
and it's not going anywhere, and you're not diabetic or anything like that. You might want to get that checked out. If you have a mouth pain as well that does not go away again, going over 3 weeks, a lump or a thickening in the cheek, and that is something that you can feel with your tongue. So if you run your tongue along your cheek, you can be able to identify if somewhere is lumpy or if it's completely normal.
Right.
You may also notice that you can have white or red patches on your gums, your tongue, and if you look in the back of your throat and you can see your tonsils, that is also included, and also the lining of the mouth. So anywhere within the oral cavity that you notice red or white patches, that can be a sign of oral cancer. There's also another one, and that is something that is common. You can mistake this for anything, and that's a sore throat. A sore throat is something that you typically get when you get sick. So if you have a flu or if you have the cold, a sore throat comes on. Sometimes it's the first thing that comes on, or it's the only thing that comes on, and you don't get any other symptoms.
Right.
You can also have a persistent feeling that there's something caught in your throat. So sometimes you feel like your throat is a little bit lumpy, or you're having difficulty swallowing.
Right. Right.
You can also have difficulty chewing. So if you notice that you're avoiding certain areas in your mouth because it hurts when you eat, you may want to get that checked out. Also, something that is very out there would be a change in your voice. And I'm not talking about puberty or hormonal changes. Yes, because oral cancer does affect your throat as well. And you know that your throat, houses your voice box and stuff like that. So it does affect the way your voice sounds.
Wow. Quite a number of symptoms, Chantal.
Yes, it's a lot, and it's a lot that coincides with other illnesses. So if you notice that you have something that is going on 3 to 4 weeks, you really do need to get that checked out.
Great. How is it diagnosed though? How is it typically diagnosed?
So the diagnosis, it can come with a single diagnosis tool, or you may need to use a variation of tools. And I'm going to give you some examples.
Mm-hmm.
So let's say you're going for a physical exam with your doctor. They can find it there because you know that your doctor has to check every part of your body. So they can find it through a physical exam. Your dentist can find it through an oral exam.
Mm-hmm.
You can also find it through a head and neck exam, and that's when they inspect all the areas of your head and neck.
Right.
You can get a diagnosis through a biopsy, and that's when something is removed and then they test it.
Mm-hmm.
You can also diagnose oral cancer through imaging tests. So, you know, ultrasound, MRI, CT scan,
Mm-hmm.
stuff like that. And also, it can be detected in a blood test.
Mm. Wow.
Yes.
Let's get a little deeper.
Mm-hmm.
What are the main types of oral cancer?
So there are many different types of oral cancers, but more than 90% of oral cancers are what we call squamous cell carcinomas.
Mm.
And that just means that it's formed in the flat,
Mm.
thin squamous cells that line the mouth and the throat. So that type of cell is predominantly found in your mouth and your throat, and that is where the oral cancer usually is formed.
Mm-hmm.
And because of this, the treatment is usually guided by the cancer type and not by its location.
Mm.
So even though the oral cavity is a small space,
Right.
it's made up of many different tissues because, as I said before, it's made up of many different tissues, many different bacteria, and it's a very complex setup, although it is very, very small.
Mm-hmm.
And the most common location for oral cancer in the oral cavity are the tongue, the tonsils, the throat, like I said before, your gums, and under your tongue, which is the floor of the mouth.
Mm-hmm. You say complex. Is the treatment complex? How is it typically treated? Is it a
Well,
complex process? Walk us
okay.
through.
So with oral cancer, the sooner you find out that you have it,
Mm-hmm.
the better it is for you to tackle it, because the treatment, it can be very expensive,
Mm-hmm.
and it can be one therapy or it can be a combination of therapies depending on where the cancer started.
Right.
And like I said before, the advancement of the disease. So surgery is often the first line of treatment that they use if the cancer hasn't spread. But surgery is also common to treat an advanced stage or recurrent cancer. So often that is used in combination with radiation therapy
Mm-hmm.
and, chemotherapy and other targeted therapy. Some of the surgical procedures, though, they can be very extensive, and they can remove parts of your mouth that you may not want to go.
Right.
So, like for instance, there's something called a mandibulectomy, which is when a part of all of your lower jawbone has to be removed.
Oh.
Right? Also, glossectomy, which is all or part of your tongue needs to go.
Mm-hmm.
So it is very, very extensive, and
Right.
you know that you use your mouth for almost everything, to talk, to eat,
Right.
stuff like that. So if you lose a part of your mouth like that, you're going to have a difficult time
Mm-hmm.
speaking and eating and chewing and stuff like that. And sometimes
Oh, no.
even a part of your neck
Mm-hmm.
has to go. So they have to remove the lymph nodes that are in your neck as well, and stuff like that. But that depends on the severity or the
Right. Of the
advancement
cancer.
of the
Right.
cancer. Right.
Mm. So you say removal of all or part of the lower jawbone,
Right.
removal of all or part of the tongue,
Right.
or the neck.
Yes,
Yeah.
the neck as well.
The neck as
And
well.
as well as the upper jaw. They
Mm.
can remove a part of the upper jaw as well,
Mhm.
depending on where the cancer is. But it's also important for me to tell you guys that although you have to remove parts of the
Mm-hmm.
the mouth, the oral cavity, there are surgical procedures that have been invented, or techniques, I should say, that help to restore the features and functions of the mouth.
Mm-hmm.
So let's say, for instance, a reconstructive surgeon removes a part of the tongue,
Right.
right? They can use soft tissues in other parts of your body to create something called a skin graft
Right.
to kind of reform the tongue so that you can have some kind of function
Mm-hmm.
with the tongue.
Right.
So there are options, but as you can imagine, it is very costly.
Mm-hmm.
And oral cancer is, like I said, one of those cancers that if you don't catch it very, very early,
Mm-hmm.
the prognosis is very poor.
Right, and it may affect patients' their appearance and ability
Right,
to
right,
perform.
because
Yeah.
because your face is what they say. Your face is your money maker.
Mm-hmm.
So
Mm-hmm. Mm-hmm. Yeah. Yeah.
the first thing that you see is your face.
Is your face.
When someone smiles, the first thing that you see is the teeth, and a smile really it
Mm-hmm.
can warm the room, and it can change your mood. It can change someone else's mood.
Right.
So when a part of your facial feature is gone,
Mm-hmm.
I can imagine that
a
is
main
something,
feature
and
too. Yeah.
exactly.
Yeah.
I can imagine that it is something that is very difficult to cope with.
Right.
So I'm sure that not only it takes a physical toll, but it also takes a mental toll. And you need your strength when you have to go through any type of cancer treatment.
Mm-hmm.
So it is very challenging. But this is why I also try to encourage patients to just get your annual checkup. If something is wrong, don't try and treat it at home. Not everything can be fixed with salt water or garlic.
Mm-hmm.
You have to try to get professional advice and seek professional help sometimes.
Mm-hmm. Well, one of our listeners asking, Yolanda is asking, can you catch it by kissing a partner?
No, you cannot catch cancer by kissing someone. That would be more of a, what can I say? It's more of like a sexually transmitted disease,
Right.
or infection or something like that.
Right.
So let's say herpes, for instance, if someone has an herpetic lesion and you kiss them, you can catch it that way. If it's an active lesion, then you can catch it that way.
Yeah.
And also HPV. But HPV is one of the other ways that cancer can develop, oral cancer can develop.
Mm-hmm.
So if someone has HPV and you are in contact with them in that kind of manner, then you can get that infection, and then that can lead to oral cancer.
Yeah.
And also cervical cancer, as we know.
Right. All the time, regrettably, Chantal, tell us, how can we find you again?
You can find us at 88 Barbican Road. So that's Barbican Business Center, Unit 12. Or you can find us online at Pure Smiles JA, and that's for Facebook, Instagram, and Twitter. You can log on to our website. It is www.puresmilesjamaica.com. Or you can give us a call at 876-798-7107.
Can I thank you? Always a pleasure having you, Chantal.
Yes, and it's a pleasure being here and interacting with the listeners. So thank you so much for your question.
Great. Wonderful. Catch you. All the best. Keep safe.
Great. You too, Shivani.
Great. Yeah, my friend Chantal Richards there from Pure Smiles. Yeah, April is Oral Cancer Awareness Month. Yeah. That's the Health Away today. Catch up with you tomorrow at the same time for another interesting feature. This is Love on 1 FM, the family station.
Precious moments we share with you, everything's so right.